Welcome back, Dr. Buzaglo. So last week we talked about how to reinforce the bladder muscle in order to help and reduce urge incontinence. Today, I want to talk about another issue that moms experience, but also women affected by menopause and also certain cancer treatment: laxity and dryness. Can you tell us a little bit more about the diVa treatment that we offer here at Victoria Park Medi-Spa?
Sure. So in general, there are two major life events that can affect a woman's vaginal health. The first is childbirth and the trauma associated with childbirth. And the second is menopause and the lack of estrogen or reduced estrogen from menopause, and one of the long-term effects of menopause. So the diVa laser treatment is...
So it's a laser?
Yes, it's a laser, just like a laser for the face.
Like a BBL?
Different than BBL. It's a specific technology. In fact, the diVa laser, because there are several different lasers out there, is the only one that has a hybrid technology, so that it works for several different issues that women can face, including vaginal laxity that is often found after childbirth, and also vaginal dryness and tightness and pain from sexual intercourse. So this laser technology works with two different lasers, one that works on the surface epithelium, the mucosa of the vagina, by increasing glycogen production, and the second laser works more in the deeper tissue of the vagina, called the lamina propria, and increases collagen, vascularity, neuronal regrowth.
That sounds amazing. So it's like getting your facial every 3 months. So how often would you get that diVa treatment?
So the diVa treatment is done usually over 3 sessions, 4 to 6 weeks apart.
Okay.
It lasts about 3 to 5 minutes, non-painful.
Okay. Oh, wow. That's fast.
And it's very fast. There's a probe, sort of like an ultrasound vaginal probe, that goes into the vagina with a one-time use cover. Okay, so very hygienic, of course. And this emits a laser 360 degrees in the vaginal wall and helps to resurface and recreate vaginal health.
That's amazing. And how long would it last? Like, would you have to come twice a year, once a year? Like, what would be the maintenance to keep up this?
Typically, it would last for about 18 to 36 months,
over
depending
a
on
year.
the woman.
That's amazing.
And women will need a touch-up treatment every few years. So this laser treatment is an alternative, for example, for menopausal women, because typically after menopause, after the hot flashes and the night sweats and the mood instability, etc., is past, one of the long-term consequences of menopause is, from the lack of estrogen, vaginal dryness. And many, many women will suffer from this problem. And of course, it'll affect their self-esteem, their interpersonal relationships, from difficulty having intercourse. And many, many women suffer from this. This laser therapy is really revolutionary for them. And is an alternative to using vaginal estrogen, because we know the vaginal estrogen...
That was another question I had. So if you do this treatment, you can just be out of the estrogen? Well, you don't need to take a supplement.
So the traditional treatment for vaginal dryness is local estrogen. Okay, local estrogen is completely safe and is given in either a cream form, a tablet form, or a ring that sits in the vagina for 3 months at a time. The tablet and the cream is done every night for 2 weeks, and then twice a week for maintenance à vie, long term.
Yes.
And some women don't want to do that, or some women don't want to take hormones for many reasons. And some women can take hormones. For example, breast cancer patients, this is an ideal treatment for them if they're suffering from vaginal dryness, because their oncologist will not let them take local hormone therapy. And so they're perfect candidates for this treatment if they're suffering from vaginal dryness.
So Dr. Buzaglo, I want to know exactly how does it work? How do you fix laxity?
Sure. So the diVa has different settings for different situations. So for example, for laxity, it'll be on a certain setting, and for postmenopausal dryness and tightness, it's a different setting altogether. So this laser technology, when we see it in the histological slides, the before and after, recreates the vaginal wall mucosa. So increase nerve endings, blood flow, collagen, everything that is recreated to premenopausal mucosa.
So now I'm going to jump to a question that I got from one of my followers, and she was wondering if ever the diVa can work in some aesthetic type of way because she was complaining about her lips laxity.
Yes, sure. There is a type of diVa called the diVa Tight,
Okay.
which is done for aesthetic reasons. I don't perform those procedures. I focus on the functional aspects, but surely it can be done by technicians here at Victoria Park Medi Spa.
So, Dr. Buzaglo, lucky me, you are my doctor, so I have access to you. I was wondering, how do people can get these treatments? Like, do they need a prescription? Can they come see you directly? How does it work exactly?
So, well, they have to make an appointment at Vic Park for consultation. Consultation is covered by Medicare with me, or with a technician that could explain to them the procedure. But really, they really should have a proper physical exam and discussion of the treatment to better understand what it is and make an informed decision.
So they can come directly to you at Victoria Park Medi Spa.
Yes.
Okay, well, that's priceless. Thank you so much for your time, Dr. Buzaglo. That was a really fun episode, and we're keeping the best for last. So next week, stay tuned because we're going to talk about the O shot and the G shot. We're going to talk about orgasm, and this is a really nice rendezvous. Don't miss it.